Hi, my name is Drew Single, and I'm co-director of the Boston Lymphatic Center and associate professor of surgery at Harvard Medical School. It's really my honor to be with you here on World Lymphedema Day 2022 and to talk to you and with you about one of the questions we commonly get. Does having lymphedema lead to having extra fat? It's actually one of the biggest misconceptions in lymphedema, even within the medical community, that lymphedema or edema is the buildup of fluid. And actually, in the majority of patients who present with lymphedema at our center and across the world, they have accumulated extra fat from the fluid that has been backed up. And so we're going to go into that a little more in the next few minutes. So a lot of us got into the field of lymphatic surgery, came to it, the majority of us, because we were microsurgeons. So we were operating on vessels that were 1 to 2 millimeters in size. And lymphatics are small. They are what is considered super microsurgery. They're less than a millimeter. And so microsurgeons naturally tended towards lymphatic surgery so that because they had the skill set to go to that next level and operate on these small vessels. And yet in doing so, somehow this concept that there was fat deposition was percolating, but maybe didn't hit us as much as the other operations, such as a lymph node transplant or a lymphovenous bypass. And so I remember in 2017, I told Kathy Shalhoub, director of our lymphatic treatment clinic, you and I said, Kathy, need to go to Sweden and learn from this gentleman, Hakan Borsen. And Dr. Borsen is a professor at London University in Malmö. He's truly taught me, and I think the majority of our team, most of what we know about fat in lymphedema. And here we were out to dinner with him. We spent a week with him and his team. We were out to dinner with Karin and Barbara, and we learned so much from them and are thankful for their education. And really, it was in 1997 that Dr. Borsen started talking about this. This is his 1998 dissertation on this, where he really emphasized that there is fat deposition that occurs in lymphedema. He goes on to talk about a procedure for the treatment of this, which we'll talk about a little later. And here's a figure from one of his papers where he actually goes over how when there is backup in fluid, it makes these what we call precursor cells that haven't really decided if they're going to become mature cells or not. And it actually converts them over from a precursor fat cell to an actual fat cell. And that's where that fat buildup comes from. And this is actually a slide from Dr. Borsen, where this is from London University, where they show a cadaver, actually, a human that has passed. And they show both sides. And they show on the lymphedema side, there's clearly extra fat buildup versus the normal side. So this is very visual. This really is actually hard to be missed. And these are like two different patients here from our center where you can see they both have fluid in their affected extremity. Let's go over and look at their fat side. So if you look at the fat sequence here, here's the normal fat and here's the abnormal side. And you can see maybe it looks like there's a little more fat, but the fat is the bright signal and the darkness is actually fluid. So maybe actually there's just a little extra fluid there pushing the fat cells, making them look bigger, but it's actually not that much extra fat. But look over here. This is as clear as really can be. Look at this very thin layer of fat right here. And then look at the affected side. You can see all that extra fat that has developed in this extremity. So this is clearly a fat dominant patient. And this is actually not a fat dominant patient. So you might be sitting there and saying, well, so I have lymphedema and I think I have extra fat in my affected extremity. What now? Well, Dr. Borsen also went on to talk about a procedure called debulking. And it is power-assisted liposuction. This is nothing like cosmetic liposuction. This is a very rigorous operation. It takes multiple hours in the operating room. And we are literally removing liters of fat from one extremity. And it requires specialized team and a specialized equipment. Here are just some results where you can see this patient has breast cancer-related lymphedema of the left upper extremity right here. Her volume difference is 51%. 1 year after the debulking procedure, you can see right here, and her volume difference is 5%. And we've shown in published work that in our first 40 patients, the average volume difference is about a liter, and we can get almost all patients. In this scenario, we got all patients down to smaller than the other extremity. And here's a gentleman with lower extremity lymphedema. Here he has a 56% volume difference. And here, after 1 year after a liposuction procedure, his volume difference is at -8%. And here again, in published data, we showed the average volume difference in a lower extremity is bigger than an upper extremity. It's about 3 to 4 liters. And again, 0 represents the other extremity. And you can see over the course of over a year, we can get pretty close to the other extremity. And this is actually Mr. Fields. You just saw his legs, and he is kind enough to talk about his experience.
Hi, my name is Jonathan Fields, and I am a 50-year-old lymphedema patient of Dr. Singal's. I had the debulking procedure done almost 2 years ago in January of 2017, and have been in full compression 24 hours a day ever since. I have to say that I'm extremely thrilled with the procedure. I feel 10 times better than I did prior to the procedure. Have returned to a lot of the activities I was not able to do prior, such as golfing and playing tennis. Able to sit for longer periods of time without any discomfort. Able to go walk. Distance doesn't seem to be any issues. My lymphedema started back in August of 2013 with swelling in my left foot, which progressed up to my left hip pretty quickly. I tried the best treatment at the time, wearing 5 ACE bandages wrapped in succession, one over another from my toes up to my hip, but didn't really see any benefit to that. I wasn't receiving any pain benefit. It wasn't increasing my range of motion. So after about a year of doing that daily, I just stopped and thought that it was something I was going to have to live with. Thankfully, Dr. Singal and his team at Beth Israel had provided me with what I consider to be the best care in the world. Beyond their medical knowledge and what they were able to do with my lymphatic system, reducing the size of my leg back to normal, hopefully having a lymph node transplant in the near future. I have an appointment in January. Their care and compassion is world class, and Dr. Singal has forever changed my life for the better. And I hope that he is able to continue to make this amazing opportunity available to anybody suffering with lymphedema around the world.
And I want to thank first Mr. Fields for sharing his story. And while we were able to really change Mr. Fields' life, I actually just got off the phone with him. I think we're now 4 or 5 years out from his procedure, and he is as thrilled as ever. There are still many questions we don't know, that we don't know the answers to. And we here at the Boston Lymphatic Center, we are NIH funded at both Boston Children's Hospital and here at BIDMC for our lymphatic work. And we are actually working to better understand why there is fat deposition in lymphedema. Believe it or not, we don't know the answer to that question in 2022. So working with Dr. Wescott in our endocrine department, we have been taking fat from the affected extremity, 1 gram, a drop of fat from the unaffected extremity with the permission of the patient. And we actually have been doing something called single nucleus RNA sequencing. Basically, we break it down to the single cell and we look inside the cell and we see what kind of cells do we have and how are the gene expressions different. And using that, we want to try to figure out why patients with lymphedema go on to develop fat, and we hope to contribute to that scientifically moving forward. Now, if this talk has been helpful or you're interested in learning more about treatments for lymphedema or lymphedema itself, actually, just understanding the disease, I have written a book, Understanding Lymphedema, Keeping the Train on Track. I wrote it and it's illustrated by a wonderful CLT, local CLT, Megan Bellinger. And the forward is by the Academy Award winning actress, Kathy Bates. If you would like to get a copy of the book, there's a few ways you can do that. It's available for free. You can just Google the Boston Lymphatic Center, go to the bottom of the webpage, and there's a scrolling bar here to scroll over to Understanding Lymphedema and just click Read More. And you can get the entire book right there. Or you can call us on our toll-free number, 1-833-4-YOUR-LYMPH, and speak to Miss Anne Marie Childs, and she'd be happy to get a book out to you. So you actually have a paper copy. With that, again, it is World Lymphedema Day. I want to reminisce to 2017 when we first celebrated this here in Boston. As you know, we do. It is a state proclamation. We do have the Zakin Bridge turned teal, the official color of lymphedema, on World Lymphedema Day. And here's our entire team with Lisa and Kathy, the Learn Mass chapter chairs, sharing in this important occasion and day back in 2017. And on behalf of all of us here at the Boston Lymphatic Center, we really want to wish you the best and thank you for allowing us to be part of this special day with you. Take care.